Okay, one of the things I wanted to touch on, which I alluded to in the previous video, are many variations of the hip, foot, and knee positions in Santi that at least that I've encountered and or have observed in the practice of Xingyi. Okay, so we'll review in detail the what I'm going to call the compact stance, because the way it looks, it's like tighter in. So we see here the body is turned away at an angle, but the head is facing forward, so there'll be a little rotation in the neck. The front knee is turned inward, and the rear knee, I didn't draw it very well, but the rear knee would typically be tucked almost right behind this front knee. And then in both cases, the foot is roughly in line with the knee. You see it's slightly turned out here, but it's mostly in line with the knee, and the same here. And what you see here, if the person's turned at even more of an angle, we'd get almost like this diagonal triangle going this way with each other. And so with the lines here, it makes it a little more obvious that we have internal rotation. This line between the hip and the knee is less than 90 degrees in the rear leg, and also in the front leg. We'll have also internal rotation. And so what that ends up amounting to is more activation in the adductor muscles, and in the medial fibers, or the fibers towards the center of the body, going towards the center of the body, are more activated. Moving on to what I'm going to call the square stance. It's not the official name, it's just more straight on. We see here the body's mostly facing forward, though it can be done with a slight angle. Head is facing forward. Both knees are pointing forward towards, if there was a target in here, they'd be pointing this way. And the front foot is in line with the knee, but the rear foot is turned outward. And there's kind of a torque at the knee here. So we'll see as external rotation in the ankle. If the body's turned to rotate a little more, you'll get more internal rotation in the rear hip. And this external rotation of the ankle with the knee facing forward. If you try this out, you'll feel a stretch along the inside or medial side of the knee, and you'll also feel more activation of the lateral glute fibers, so the ones on towards the side of your rear. And that's what I'm going to call this the open stance, because the hips are more open. So once again, body's mostly forward, though off at a little bit of an angle. Head facing front knee straight ahead, but the rear knee now is going to point outwards at an angle, and the foot of the rear will also be in line with the knee, and the front foot will be in line with the knee. So we'll see there's more external rotation in the rear hip, and when you spread the floor, this will create more activation in the abductor muscles. So just wanted to clear that up. Just go through some of the variations that are there, but everything in the previous video will mostly still apply. As you spread the floor, the hamstrings and glutes will still activate, and as you push the floor forward, the quadriceps and hip flexors will still activate. It's just the contribution of the adductor and abductor muscles will change depending on the whether there's external or internal rotation of the hip, and the rotation of the ankle. All right. If you like it, please hit the like button, share, and drop a comment below. I want to hear anything you want to say, even if it's a critique. I'm not a physiologist, and I'm just learning on my own here, and thought I'd share with everybody.